The Dr. George Mukhari Hospital, as well as the Charlotte Maxeke Academic Hospital, have now been added as key vaccination sites. eNCA reporter Slilindelo Masikane is on a walkabout today with the Gauteng Premier, as well as the Health MEC at the Chris Hani Baragwanath Hospital. They are there to monitor the progress of the vaccination program. So good news, Slee, that 2 more sites have been added.
2 more sites are going to be added, Jeremy, once we get the second batch of those Johnson & Johnson jabs. We understand that, of course, the Steve Biko as well as the Chris Hani Baragwanath Hospitals were the only 2 sites that were allocated. And over the past 2 weeks or so, we've seen a number of backlogs at these particular hospitals, and that is due to the fact that we do have a number of healthcare professionals who are eagerly awaiting to get their jabs. And in fact, when we were speaking to the Premier earlier on, he was telling us that we had healthcare practitioners coming from other provinces like Limpopo as well as Mpumalanga, which led to a number of bottlenecks here in the province when it comes to the long queues that we were told were being experienced at these 2 hospitals. But to just give us more context, I am joined by the head of vaccinations here at the Chris Hani Baragwanath Hospital, and that is Dr. Titi. Dr. Titi, I'm just going to come to your left, and I want you to walk us through exactly what we're seeing right now that is happening at this particular vaccination site.
What is happening now, the healthcare workers who require vaccination are now walking into the hall, and they'll be sitting next to each vaccination station, waiting to be vaccinated. As you can see on this row, the healthcare worker is now getting ready to be vaccinated, and the vaccinator is going to check the healthcare workers' demographic details and ensure that is the right person that's going to be vaccinated, and then they will start vaccinating the individuals.
Just walk us through the logistical process of having to put this operation together.
We've been working for the past 3 to 4 weeks to ensure that we can put this operation together. A number of staff at our establishment have been involved, starting from the doctors down to our IT community, and they've put a lot of work to ensure that the center runs smoothly, and a number of personnel to ensure that on a day-to-day basis we have enough queue marshals and there is no stampede within the hall.
What has been the response in terms of the healthcare professionals coming to get vaccinated? It looks like to me, it seems there's been quite a large response.
We have had a huge response in terms of the vaccine uptake, and this week we have been vaccinating close to 1,000 people per day, and the last 2 days we have vaccinated 1.7 people each yesterday, and today we are on course to vaccinate 2,400 people today.
And we understand that all 16,000 doses will be administered by the end of today. Just tell us what kind of issues you had to iron out, because last week we did hear that this particular site had to be closed for a day.
If you are talking about the weekend, we actually took a considered decision after interacting with a number of doctor community groups, and realized that it would be in the best interest of the center not to open for security reasons. We had a considered decision that it would be a security risk for us to open over the weekend. As the numbers that were being given to us, we thought that we wouldn't be able to, will be putting the participants at risk by allowing them to come on site. We then decided that we will work over the weekend and ensure that by end of business today, all the doses that have been allocated to us will be used.
Just how important, Dr. Titi, are these vaccination processes for healthcare professionals?
In the past year, we have had a number of healthcare professionals suffering from COVID. That had resulted in the depletion of our workforce, and on some days a lot of us had to take strain in terms of covering for our sick colleagues, and vaccination as one way of ensuring that there is a decline in the number of healthcare workers who are infected with COVID will ensure the smooth running of our hospitals.
Have you gotten your jab, or are you looking forward to getting your jab?
I've had my jab, ma'am.
You've had your jab. How are you feeling?
I've been well. I'm fortunate that I did not suffer any untoward effects from the vaccination.
What would you say to those that are anxious, kind of scared of getting the vaccine?
The vaccine is very safe, and as you know, it will ensure that prevent mortality and morbidity. And I would encourage everyone to receive their vaccination.
Thank you so much, Dr. Tita. I really appreciate it. As you can see, Jeremy, we've got a number of healthcare professionals getting their jab. Mama, how are you feeling?
I'm feeling okay,
Yeah?
but I'm nervous. Yes.
Yeah. But you're excited that you finally got it?
But I'm excited. Yes, I am excited because at last I've got it. Yes.
Okay, thank you, Mama.
Oh, thanks.
All right. Okay, Jeremy. Well, that's where we can leave it for now, Jeremy. As you can see, the process is really underway, and it seems that a lot of the issues that were experienced over the past week have been ironed out. We understand that Gauteng is also looking forward to getting more of the J&J jabs, but they will be completing all the doses that they got by the end of today.